future veterinarians. This is Dr. K on the podcast, and this is my very dear friend, Dr. Alicia Ragni. Dr. Ragni was my mentor when I first started out in the ER. Unfortunately, she worked days. I worked nights, so the only time she could mentor me was in morning rounds after my shift, my 12-hour.
Or evening rounds.
Or evening rounds.
I was leaving and you were coming on?
She was leaving and I was coming on. So that's when I got my mentorship, unfortunately. Most of my mentorship.
On the fly, kind of.
Yeah, during rounds with Dr. Ragni. But she was the one who really took me under her wing and tried to teach me the ropes of being an ER vet. So, and she's here, and we're very excited to be talking to you today from Reno, Nevada, because she got a 2-for-1 registration deal for the Wild West
Veterinary Conference.
Veterinary Conference in Reno. We have not gambled. We have had some alcohol, not today, not right now, but
later.
Maybe later. Oh, definitely later. But she has graciously agreed to talk to us about her experiences in particular as a board member of the Illinois State Veterinary Medical Board.
Right.
Correct. But first I wanted her to tell a little bit about her history.
Well, I graduated in 1990 from the University of Illinois. I spent the first 7 years more or less in general practice. In 1997, the opportunity arose to begin what was then an after-hours emergency clinic, animal emergency in McHenry County in Crystal Lake, Illinois. We recently, well, not so recently, became 24-hour clinic and changed our name to Companion Animal Specialty and Emergency Hospital.
Yeah, before we move on to your experiences on the Veterinary Medical Board, you were a founding member of the hospital where I started my career.
Yes.
Mm-hmm. And that was only 7 years out of school, right?
Correct.
So at that time you were working as a general practice
and we're doing
veterinarian.
Relief, yes.
And doing relief.
Day practice and really, mostly relief.
Okay. And so you got together with other general practitioners in the community to start this
there was like 18 of us originally.
Okay.
But I was the only doctor who was actually employed as a doctor, and I was the original director of medicine.
Right. Okay.
And I had a practice manager who came on, and we're both still there after 20 years. We just celebrated our 20-year anniversary.
That is so amazing.
Go Case.
That's really congratulations. I mean, what a huge, that was just an idea, and then you went for it, and then 20 years later,
and I found, more importantly, I found out that I really liked emergency medicine.
Right.
I mean, I just really never found a home in general practice.
Yeah.
That's not saying it's bad. It's just not for everybody.
Uh-huh.
And I really like kind of I like emergency.
Yeah.
Although now I'm kind of doing quasi-critical care. I'm not a boarded. I've never done a residency. I'm not boarded.
Right.
This has all been on the job training and
you're what's there.
I'm what's there.
Yeah. Yeah. I mean, that hospital had some very, very sick patients.
Yeah.
Who gets very sick patients.
But it's amazing what you can do when you apply yourself and you use your skills.
Mm-hmm.
I mean,
yeah.
I know, everything is high tech, but boy, a history of physical exam, your eyes, your observations.
Yes. I remember you set up a jury-rigged apparatus that I'd heard about in vet school, and I was just like, you've got to be kidding me, to measure blood pressure.
Oh, a manometer? A central venous pressure?
Yes.
No? Okay.
I can't remember. Yes, it was. And it was, you had a ruler,
mm-hmm.
and you used some lining from like a fluid bag or something.
Mean jury-rigged? Yes.
Oh, jury-rigged. What did I say?
Yeah, it was, well, they sell manometers. You can measure central venous pressure. They have.
I remember you set it up with a ruler though, and you were like, and so you want to pick the ruler up until the numbers at this, and I was like, what, woman? Anyway, but yes, I've always been very impressed with all your skills and
sometimes one of the neat things about veterinary medicine is sometimes you get to be a little bit of MacGyver. You have to just kind of problem solve outside the box.
Yes. Yes, we know that because we don't have all of the resources and
sometimes not
support that they do in human medicine, unfortunately. So you got to make do with what you've got. But so 7 years of general practice, and then you decided to.
Well, the opportunity came up, and I knew that I wasn't exactly in love with general practice. I mean, I could do it.
Yeah.
And so this came up, and I said, why not? So I did.
Okay. But how did you start the hospital? I mean, like all the practice owners went in to buy it?
Right. We put in a nominal investment, which at the time is ludicrously low. We started in somebody else's practice just for the first 9 months. He was a day practice. He was one of the shareholders, but we didn't want to stay there. So we diverged. He built a practice, and we found a rental property in town.
Okay.
And then we kind of were really on our own.
Right. But at first you were operating night hours out of his practice.
Yes, but only for the first 8-9 months tops.
Right. But that makes sense. That's a good place to start because then you don't have the extra rent.
Correct.
And if it all falls to pieces and you find out it's not economically viable, well, you didn't invest in a year contract.
Right. You're not paying off a lease.
Nice. That's really clever. Yeah.
We used his equipment. So yeah.
That's initially, great. That's great.
It didn't fall flat. It actually took off, and it's been growing ever since.
Yes. Well, because you started and you were prudent every step of the way. If you'd gone out and just like signed, an expensive contract on a beautiful property for a year,
it would have made cash flow a lot harder.
Exactly. And it might not have made it. So, yeah. I love these stories about how things like that get started because by the time I came to the hospital, it was already 24/7.
You just stepped into it.
Yeah. It was already, everything that you built up, but you were there in the beginning when it was just starting out.
I like to think I had a little bit to do with it.
Oh, I'm sure you did. Yeah, you were medical director for almost up until the point where I came on board. Yeah, and Dr. Ragni is actually the one that got me the interview with the medical director there. So she saw my resume and thought that, I don't know, even though I was a new grad.
I was impressed.
Because of my past experience.
Well.
That was not veterinary related.
But it matters. It figures into the equation somewhere.
So that's what the medical director thought when he hired me. Because of my professional experiences, I would be good at talking to clients and lead it. And yet that was not true. Anyway, it's completely different. But that's for another podcast. So let's talk about how did you and when did you have the opportunity to get onto the state medical board, veterinary medical board in Illinois?
So the Illinois, so all states have a Veterinary Practice Act that tells you the scope of practice, what you have to do to become licensed, and then what you have to do to keep your license, what would constitute a conflict, a breaking the rules, so to speak, that might get you in trouble. Every state is a little different. They all have a board. The board is selected from local practicing members. So I really don't know how I was selected. I got a letter one day that said, hey, do you want to serve on the board of the IDFPR, Illinois Department of Professional and Financial Regulation? Obviously, they oversee all the licensed things in the state of Illinois, from hairdressers to veterinarians to roofers to boxers.
To doctors.
To nurses, pharmacists. I mean, there's over 100 different professions that are licensed.
This is why you can never get them on the phone there in Illinois.
Well, because they handle all of them, and there's a lot of them, and a lot of licensees.
Right.
So
which is totally different from how it is in Arizona.
Every state is going to be different.
Right. Okay. Gotcha.
So I got a letter. I drove from my home in Crystal Lake, which is about a 4.5 hour drive to Springfield, Illinois. Literally had a 10-minute interview. Didn't think I did anything that impressive. Drove home going, that was a waste of a day. And sure enough, I got a letter saying, congratulations, you've been selected to be on the board. So I figured, you know what, it'd be a learning experience for me.
Absolutely. And how long ago was that?
I served from 2005 to 2015 until I termed out.
Okay, so 10 years.
10 years. So I did a two-year term and then 2 4-year terms. And then they want new blood. They constantly want, because they don't want people who are entrenched, exactly.
Enmeshed. You get too many tendrils out in the community, maybe. I don't know.
Not even that. I think just they want fresh blood. And I think that's a good thing.
I think so too.
The standard of medicine is constantly changing. You want to keep up with that. And you want that to reflect that in the board members.
Right. That's the other thing I just want to interject for a moment is that you've been practicing
since 1990.
So many years now that, and there are vets out there who've been practicing as many years as you.
Oh, sure.
Yet haven't kept up as vigilantly as you have. So that's something that I've always admired about you is like Dr. Ragni is current and she's always trying to learn more and push yourself. So that was just an aside.
No, thank you.
But not everybody does that.
Some don't.
Yeah.
Or don't do it as much as they fall into. Everyone learns shortcuts or bad habits. It depends on how you.
Or it was what they were taught when they got out of school 30 years ago,
and they just never got away from it because it worked.
Right.
And they never suffered any ill consequences from doing that.
Right. As my gastroenterology professor from vet school used to say, sometimes a milliliter of subcutaneous urine will fix the problem in your patients. And his point was,
you're right.
You give the sub-Q urine, and nothing bad happens and the patient gets better. Does that mean it was the urine that you gave that got him better? No. Anyway.
Perception is everything.
Yeah. Too bad we're not. Anyway, the sort of placebo effect also could be at play. But so 10 years you were on the board, and when they sent you that letter, it must have just been randomly generated.
I guess, and this is what I don't know, is somebody must have thrown my name out there. Maybe it was random or somebody threw my name out there.
Okay.
Whether it was a compliment or a joke, I'm not sure.
Oh, come on.
I don't know who that was, or they said, no, you were nominated, or somebody put your name out to do this.
Okay. Well, so at least in Illinois, somebody needs to have suggested you.
Apparently, I guess. I'm not sure, but I've never suggested anyone, and I served my time.
Okay. I wonder if you could just like approach the board and say, hey, I'm interested in serving. And
I don't know, and I don't know if that
couldn't hurt. And you could find out what the process is for becoming a board member in whatever state you end up in.
I don't know that there's a huge line for people to do it. I mean, it does take a time commitment.
Yes.
I mean, we had board meetings sometimes up to 4 times a year, but a lot of those were canceled. And they would alternate between Chicago and Springfield.
Oh, my.
And they try, Illinois is a long state.
Yes.
They tried to select practitioners that represented different areas of the state.
Right.
So the ones who were coming from several hours away.
Yeah. That is.
There's travel. Yeah, I mean, at least there was some travel involved, and you'd give up a whole day. It was not a paid position.
Wow.
I would usually get my travel expenses reimbursed. So.
Why then did you want to be? You mean just
to
for
learn,
the experience?
Just for the experience, just to see the process, and to sometimes when you analyze things, it helps you say, ooh, that's a pitfall. I better not do that.
So you could learn from others' mistakes by being on the board. That's brilliant.
I make enough of my own.
But so what was that saying about the wise person learns from the mistakes of others. That's brilliant.
It's when I was reading these cases, you'd start to see where things went wrong. And and say, wow, this person was in a hole. They didn't know they were in the hole. Maybe they did, and they just kept digging. And that's what got them here. Yeah, tunnel vision is a huge problem. And we're also, every so often I'm subject to it.
Yeah. Well, I don't know. I suppose it's like, you ever play chess?
A long time ago.
And you come up with like this great strategy in your head, and no matter what happens on the board, you want to stick to that strategy because, it's just beautiful. It's beautiful. And I know I can make it work. The other guy just
checkmated you.
Yes.
In the process.
But my beautiful strategy.
Right.
So I imagine that's sort of the feeling, because it's happened to all of us. And that's sort of the feeling I have is like, no, I know I can turn this around.
Exactly. I'll just try this. I'll just do this.
Right. And that's what you see.
And you have to remember that, at least in Illinois, all my comments are going to be made with respect to Illinois.
Sure, of course.
It's a complaint-driven agency. So you can be the best vet in the world. Somebody could get angry with you and they can file a complaint. Nothing stops them from filing a complaint. It could be a spurious complaint.
Yes.
It can have no merit whatsoever.
Yes.
But it drags you through the emotional, oh my gosh, I can't believe this happened. What did I do? The guilt feelings. And most veterinarians, and I'll say the majority of veterinarians, want to do good.
Of course.
We want to hit a home run out of the park and save every patient.
Yes.
And I understand that when you're younger, that idealism is there.
Yeah.
You still want to do good or
and
right
you
by
want everyone to love you. I did.
Yeah,
So,
I mean, I think I know that's not reality.
Of course not. Well, I mean, I don't think you know that until you get out.
I want to at least try to be helpful.
Right.
In some way.
Right.
To the people and the people and the pets I encounter.
So if, a customer were to complain to the board and the reality is they were complaining to the board because they thought the bill was too high
well, usually it was a lot of them were grief complaint. We're working through their grief.
Okay.
And they're angry. So this is their way of dealing with their grief. Mm-hmm. You must have done, my pet died. You did something wrong. Mm-hmm. You have 2 years in Illinois to file a complaint.
Mm-hmm. Okay.
So, after that, you can't.
Yeah. So the grieving process, I can't remember what the stages are, but then they get to anger and they start thinking.
And they start thinking, especially when they start talking to their friends and their friends said, oh, well, your vet did something wrong. And that usually gets them thinking. And then sometimes that'll happen. Yeah. I mean, so a lot of them don't necessarily happen right away.
Right.
Sometimes they happen months after the fact.
Oh my gosh.
So it kind of catches you blindsided.
Oh my gosh. Yeah.
And sometimes you kind of know, and and sometimes you kind of know, boy, this could end, this could end up there.
But some of them you probably thought
never saw
absolutely
it coming.
Fine.
Never saw it coming.
8 months later, you get a letter from the veterinary medical board.
From the licensing board saying, so-and-so's filed a complaint against you.
Oh my goodness. So tell me how the process works. Once the complaint has been received, then what?
So it goes into the intake department. It goes to an investigator. The investigator then interviews the complainant and then goes to the practice and interviews the respondent and whoever else may be material to that case and asks for medical records. And this is where medical records, if it's one point I can pound home, keep good records. Because when I had something that was clear-cut and I could say, wow, this person did this, this, and this, and it's reasonable, I could close that case without ever having to go to conference.
Right.
Save me time and a trip into Chicago.
Saves the veterinarian.
And save the veterinarian from taking a day off of work, having all the angst that goes along with that.
Yeah. Yeah.
So if there's one thing I can say is medical records, medical records, medical records. And the problem a lot of times and here's the difference between a lot of, I'll say, family practitioners and ER vets. When I'm an ER vet, my record, I know it's going to go out to you.
That's me.
Well, let's just say you're a general practitioner for sake of discussion. Yeah. It's going to go out to you.
Yes.
Because I'm going to send that patient back to you.
That's right.
And you're going to be able to pick through everything I did.
Yes.
And say, why did she do that? Why did she do that? Why did she do that?
Yes.
However, when I get medical records, you're sending a case to me. Yes. I'm like, what did she do?
That's so funny. I never thought of that. You're absolutely right.
Because you keep medical records. A lot of times people keep minimal records because they know that patient.
Right.
And then that animal's doctor forever in a day.
Right. Especially the older.
And it's in their head, especially
GPs.
the older GPs are really prone to just jotting a few notes.
And that's it.
Yeah.
Yeah. The one guy that I worked for.
Illegible. Don't forget illegible notes. Even better. Yeah, that really irritated me.
Oh, gosh.
I need to be able to read your writing.
Yeah. Well, I think hopefully, by the time that most of the people who are listening to this podcast graduate vet school, there will be no written medical.
Let's hope.
It'll be digital.
That would
because, absolutely. The written records are a nightmare.
So, and then the respondent, which is a veterinarian who is having the alleged complaint filed against them, with also not only submit his medical records, but a lot of times they would submit a letter to the board member or the board saying, here's the backstory, here's some other things maybe that I didn't put in the medical record that influenced this case. And sometimes it did.
Right.
There's a lot of flexibility. I had a lot of jurisdiction.
Yeah.
To say, hey, you know what? This person, it's not a tight standard. You can't open the book and say, what is the standard?
That's
unlike in human medicine, where it's much more well defined because the standard constantly changes, and the standard on veterinary medicine is largely dependent on what the client is willing to do, and financially what they can do,
or even what area you may be practicing.
Well, once again, going to socioeconomic demographics,
right?
But even if they have all the money in the world and they're not compliant, it doesn't matter.
Yes, right.
For whatever reason, they just don't want to be compliant with their dog, or cat won't let them medicate them.
Right. Okay. So the medical record, that's an interesting point that you make, because, both you and I are used to writing medical records, and sometimes you think, okay, first of all, you might be in a crazy hurry while you're writing it. You may have many, many records to write. You may be interrupted multiple times while you write the record.
Yep.
You may even be thinking, should I put that in? I don't think I need to put that in, So there's a lot of things. You could spend, like, you've talked to me about a doctor that that writes a novel.
She writes either a novella or a novel.
For every medical record.
Somewhere between being hours and hours past your shift and staying until the hours of the morning, and just saying, patient okay, and that's it.
Right.
And this is where, there's
the art of,
exactly, of finding that fine line.
And knowing which parts are really important to put in.
Exactly.
But it's good to know that if you didn't, maybe you got interrupted, or another emergency came in and you forgot.
Most medical records, you can even make an addendum.
Right.
Timestamp, damn, hey, I forgot this.
Right.
It's important. I got interrupted. I got pulled away, but I came back and I made an addendum.
Yes, that's right. So I remember, just to clarify, because at the ER where we were, you'd finish your medical record, and I think that they closed
at a 14-day window, actually.
And then they would lock down. You could either lock them down yourself and say, I am done.
Or they auto-finalize in 14 days.
Auto-finalize in 14 days. And either way, even if you locked it down, you could go back in and it would timestamp the...
Yeah, and as a rule, I can't say that people ever really went back and rewrote medical records. As a rule.
Oh, not to be dishonest, but
handwritten records.
Handwritten records, you could.
You could.
Right, you could.
I mean, one nice thing about the digitized cornerstones is after that medical record is closed, you can go back and it obviously time stamps it, date stamps it.
Yes.
So you can't go back and alter the medical record. Right. Handwritten.
Right. But you can go back if you realize, the next day, I forgot to say this, and I really should have put it in, and then you just go and you add an addendum, and then it's there. So, but what are some of the things, the qualities of a good medical record that you've seen make the difference in some of these complaint cases?
Well, I think just thoroughness and completeness. Especially when you get to the point of discussing, everyone knows physical exam. That's everybody else kind of a given. History, kind of a given. Diagnostics. Some write their diagnostics, some people don't. But when you get to client communications, what did you discuss? What things did you offer that person that they either accepted or rejected? And if they rejected them or declined them, did you document that?
Yes.
I recommended, referral for your pet.
Yes.
It's not your job to be their banker.
Right.
It's not your job to be their financial counselor. It's your job to offer good medical care, appropriate medical care, and let them kind of figure out, do I want to do this? Can I do this?
Right.
And if they can't, it's okay. Then we go to B option, C option.
But you must document that you've had that conversation.
And it doesn't have to be a long... Once again,
right. Recommended referral to internal medicine.
And if you recommend it on every visit, you recommend it on every visit. You said it multiple times over the course of...
Yes.
So complaints were kind of funny because sometimes it could be a one-time occurrence. So, and I'm going to draw from my experience without, I don't remember the names. So sometimes it could be a one-time thing. A breeder comes to a doctor for a C-section, it goes wrong. That was the one thing to trigger the complaint. But I also saw complaints where somebody had been a client for several years.
I see. And they were giving that doctor leeway, and then they were finally like, this is...
Or they were either giving them leeway and the doctor just wasn't making the appropriate decisions or recommendations, or not documenting them. or once again, the pet died and they're just going through the grieving process. So, so ERs were represented because you don't have that bond with that person. Right. They don't know you. Right. So they're a little bit more distrustful. Right. So sometimes you'd see a little bit more, but complaints along that line. However, usually the medical records were better for ER doctors.
Because they know they're writing them for doctors out in the
anybody
community.
Out. Yeah, exactly. Yeah. Somebody out there.
Right.
Another big thing, veterinarians under, let's say 5 or 7 years, when you don't have a lot of numbers of cases and practice hours behind you, and maybe you're not as confident, and sometimes that comes off. That maybe, if you're not, without projecting this, I'm in control, I know the answer to everything, which nobody does. Mm-hmm. But sometimes if you're a little hedgy or wishy-washy, depending on how you present that, they look at it as, oh, she's not sure. Maybe she did something wrong.
Yes.
And I hate to use the word she because we have to go.
Right. I'm sure nobody's going to take offense to it.
I would hope not.
We acknowledge there are male veterinarians in the world, and we need more. So that's really important to keep in mind. So I think you need to project that you feel confident about yourself without acting like you know everything, because that also gets people in trouble.
And that's a skill that's honed over time. Mm-hmm. There's just no way of learning that skill other than just to get in there in the trenches and keep on digging, keep on swinging. Mm-hmm, mm-hmm.
So let's say for the more complicated cases then, so you unfortunately, you didn't find what you would have liked to find in the medical record that would allow you just to close the case and say, okay, this is spurious.
So I have some questions on boy. I'm not sure if something wrong was done. I'm not sure if something broached the standard or breached the standard of veterinary medicine and the Practice Act. So now I'm going to go to an informal conference.
Okay.
An informal conference is exactly that. It's like you and I sitting down, and that's how we try to conduct them. Okay. It wasn't an inquisition. It wasn't me, asking you questions.
Right.
Why did you do this? Because that people are scared and nervous enough.
Right.
And really the goal is to educate the practitioner. At least this is what I was told. Yes, you need to protect. The whole point of the board is to protect the public. Mm-hmm. Protect the public trust.
Right.
And boy, if veterinarians don't do it, who do you think's going to do it? Either the lay public who has no margin of error, everything needs to be perfect, or lawyers.
And they don't understand medicine.
They don't understand the nuances. Or attorneys. And we don't want attorneys litigating or adjudicating cases. We don't want that.
Right.
So we want to keep veterinarians policing our own.
Right.
And it's hard.
Yeah.
To sit in judgment of your colleague.
Absolutely.
Because I guarantee you, everybody has a bone pile out there.
Oh, yeah. So it's kind of like there, but for the grace of God, go I.
Yeah.
Yeah. So we
go to informal conference.
Okay.
We try to conduct it as let's review the case.
Mm-hmm. And this is the veterinarian gets advance notice.
Yes.
Weeks in advance, probably, and months in advance, and they come and they meet with the entire board.
No,
right? Or just
one member.
Just one member.
Once again, in Illinois, it was one member.
Okay.
And obviously, there was an attorney for the department sitting next to me.
Okay.
So my next point, if there's anything we can take away other than medical records, licensed defense, spend the bloody $100 to have an attorney sitting next to you looking out for you.
Even at the informal, whatever it's called.
It helps you feel calmer.
Yes.
Somebody's got your back.
Yeah.
Sometimes you get nervous, you get tongue-tied. Mm-hmm. And the attorney knows, they kind of know the ins and the outs of attorneys who do just medical cases.
Yes.
Yeah, they kind of know, okay, you can say that, but, we could challenge that.
Right. So just to clarify, now there are other options for liability insurance for veterinarians, but
but PLIT is, of course, the one that is usually, and PLIT is most common. Yes.
AVMA, PLIT is the liability insurance that most veterinarians carry.
Yes.
And, you can get I think I've got a 1 million per incident, 3 million per lifetime or something like that, which is at the higher end. Mm-hmm. And then you have the option of adding
licensed defense.
And I remember when I first started at the ER, they paid for my insurance. But I didn't even know about licensed defense. And I think it was actually a couple of years of practicing before I even knew this was a thing and how important it is to have it. I was just lucky.
I think just from the psychological support you get from having that attorney sit next to you, just from the ones that I've seen when people have brought them.
Yeah.
And it's funny because it's the same guy who represented most of the doctors in Illinois. So I actually, got to know him pretty well. He's a pretty good guy. And,
He specialized in veterinary medicine?
Just medical, the medical aspects of things. So MDs and veterinarians.
Neat. Well, too bad I'm not in Illinois. I'd ask you for his name just to keep it in my Rolodex. But okay, so very important. Get the license.
Get the license defense,
and it's not that much more.
It's not that much more.
Yeah, I think mine was like $50.
It's not expensive.
And the liability insurance for veterinarians in and of itself isn't even that expensive. I think my total, including the license defense for a year, for $1 million per occurrence, $3 million lifetime, I think that's what it is, was like $280 or something like that. Unlike MDs.
It's not even $1 a day when you look at it.
Right.
Unlike MDs who pay substantial, they're thousands.
Yes.
Tens of thousands.
Yeah. But it's funny, I renewed my, whenever renewing my yearly contract with the liability insurance, there's a little box that says, add license defense. And I was just kind of like, wonder where that is. Oh, well, on with my life.
Yeah.
Click. Check that box. Yeah.
So we go to informal conference. Obviously, I've read the letter from the complainant alleging what you did wrong.
Right.
And they're usually emotionally charged letters. Almost all of them are. And I have to say, is what they're saying, is there merit to what they're saying?
Does the doctor get a copy of?
No.
Oh.
They do not get a copy of what.
Don't.
Now usually the client has written them a nasty letter.
Yes, but they don't know what they've told you.
No.
Okay.
And it doesn't matter.
It doesn't?
No.
Well, how are they supposed to defend themselves if they don't even know what?
Because you have your medical record.
Okay.
If you have your medical record and it's a good record and you've done a good job.
Okay.
And you've documented things.
So this is.
It's either going to, I don't care what they say to a degree, unless they had a point.
Sure,
and I can find. When I went to conference, it's because I have a question on why didn't you repeat this?
Right.
Like there was a case, a hypercalcemia case. Dog came in, doctor did some blood work, and I think the dog was. I can't remember if the dog was ill or it was just routine blood work. Middle-aged dog, and the calcium was 12.
Ooh.
Just a little over.
That's too high for those people.
It wasn't egregiously high, but just a little high.
Yeah.
And then the dog started not feeling so good. And it was drinking more water. As the months went on, it was drinking more water. So she did urine sample after urine sample, and it was dilute and never, and I think she even rechecked the blood. She never rechecked blood work. She had a high calcium. Wow. The dog was starting to become clinically PUPD.
Okay.
And over the course of several months, and she saw the dog on and off during that time.
Okay.
And eventually the dog got worse, sicker, stopped eating, went to a different vet. What do you think that veterinarian did immediately?
Rechecked the calcium.
The blood work. And now it was 17.
Holy cannoli.
And at that point, I think the guy didn't have a whole lot of money, and you could sit there and say, well, he wouldn't have treated it anyhow. But that's not the point.
That's not the point.
So, he ended up euthanizing the dog at the other place. But had you have given him that information and then said, and even if you would have said, well, I don't have money to treat this, I'm not going to treat this. Then you say, recommended X, Y, and Z. Client declines.
Was it a tumor, or did they find out what was causing elevated
They just
calcium?
knew that the calcium was going up.
Okay.
And whether it was hyperparathyroidism, I don't know. That's at that point.
Right.
I had the other doctor's records as well. So they'll subpoena. They'll get a subpoena for those.
Okay. Yeah. Yeah. Well, and you could argue.
And it was simple to say, why didn't you? It was there. If you had any doubt, check another panel in a month or two. The dog is still obviously what you're doing. I mean, she went through antibiotics.
Absolutely.
She went through all these things.
Yeah. And arguably, I mean, I could see why a pet owner would be upset, because why did I go through all that rigmarole coming in? You know, I had to take time off work.
So that was a relatively simple thing. Yeah.
Yeah. And, you know, I'm paying for these re-exams and I'm paying for antibiotics and urine tests.
No.
And you never did the retest that should have been done. So
because anybody else would have.
Yeah.
I have to, and once again, what is the standard? What would similar people do in your position when faced with that? So it isn't my standard of medicine. It isn't, well, you didn't recommend him for a CT scan. No, it's not my standard. What would a reasonably competent practicing veterinarian do in this case?
Right. And I think anybody with a medical degree would say, recheck the calcium.
Gee, the dog's not getting better. Yeah. It's getting worse. Maybe we should pull another panel and see what's changed over time.
Absolutely. Absolutely. So, but this is what I wanted to go back to. You said that the doctor never gets a copy of the original complaint, the one that's sent to you.
Correct.
And, but is it, for instance, you know, if this were a regular legal case and somebody had brought a complaint against you, you would know exactly what they were accusing you of.
Well, usually, they will tell you substandard care was usually how it presented itself.
Okay, substandard.
Substandard care. Okay. I mean, they usually...
But they don't give you, like, the details?
No.
No, okay. Just substandard. It just seems very vague, you know?
Well, I mean, usually it is.
Okay. Somebody complained about me, said substandard care. And
well, I mean, but obviously you can go back to that case and say, oh, I remember this. Yeah, this was a real pain in the butt. This person was difficult.
Okay. So that's the informal hearing.
That's the informal hearing. And we try to determine, was something done wrong? If it was, is it worthy of a public reprimand? Or is it something that is, well, it's a little borderline? But as I said, the goal isn't to crucify people. It's to educate them, to practice better medicine.
Yes.
How can we avoid having you come back here?
Right.
Because it seemed like there was a subset of practitioners that garnered a lot of complaints. I mean, I'd see their record of other complaints, and I could see, the date and what happened, like closed. And there are some doctors who had 8, 9, 10, a dozen complaints over the years.
Wow.
So what are they doing that is causing people to want to file these complaints?
Right.
As opposed to somebody who has practiced for 25 years and has never had a complaint. I look at that too.
Right. So in terms of the informal hearing, and you have the choice of either.
Okay, so I can close the case outright. No discipline whatsoever. A lot of times veterinarians would add other details that maybe didn't warrant putting in the medical record.
Okay.
But it was logical, plausible. I could tell that they did I could tell that they in general did a good job. They certainly, most of them were very upset. They didn't, nobody likes a complaint. So I could close it outright. Sometimes I would close it with something called an administrative letter of warning, which said, well, there's a few things that are, iffy, but they don't necessarily rise to the level of a formal reprimand or formal discipline.
And the administrative letter
of warning is non-public.
Non-public.
Okay. It was an interior tracking thing for the people who would have several complaints.
Gotcha.
Because a lot of times, once again, it's one thing to have one or two over the course of your career, over a 30-year career. It's another thing to have one
every year.
Yeah, and I saw some of those, expired name it, expired meds. Just any one of a number of things. I mean, I remember one guy who was, we could be here for hours recounting cases that I read, but an administrative warning letter. It was non-public. The case is still closed. It's over. It's gone. It's done. You can't bring it back. Or I could say, you know what? This is something you shouldn't have done. I mean, you should have veered course somewhere in here.
Right.
And now I'm recommending a reprimand. And you could say, and once again, it depends on how strong evidence that I felt the department had after looking at the medical record, speaking with the veterinarian, to say, we have a pretty strong case. If it goes to hearing, there's a good chance it's provable. You'll get the reprimand.
Yeah.
Now, you can say some doctors agreed to that.
Okay. Just to like,
end it.
Stop it here. I don't want to go any further. Fine.
Yes. And so they would take a reprimand. It is a public discipline. It does not impair your ability to practice.
Okay.
Or they could say, no, I don't accept that. And then it goes to a formal hearing.
I see.
To which the original board member who reviewed the case is no longer. Now you're recused. Because the other board members, it goes to a judge, an administrative law judge, and it goes to the other board members. And there was 6 on our board, plus a public member. Okay. But the public member didn't participate in the disciplinary hearings. And it rarely ever went to a formal hearing.
Okay. Most people would just say, agree with it and be done.
Yeah, and there's times when, at least earlier on in my career, when I was just not sure, and oh my gosh, I don't want to give anybody a reprimand because how can I judge? How can I sit here and be in judgment? So there's probably some that I said, well, they're iffy, and I let them go.
Yeah, administrative letter, sure.
Yeah,
but
because because most people don't want to repeat the process. They don't want to come back.
Right. Now, the reprimand is not the worst thing that can happen.
It isn't. So the reprimand is a public discipline. So if you do a license lookup, has your name, your license number, when you were first granted a license, are you current? Have you ever been publicly disciplined? And it's either a yes or a no. If it's a yes, you click on the button, and it doesn't give you all the nitty-gritty details. It just will say something like substandard care, failure to do something. I mean, it's very vague.
Yes.
Operate. So it's a very vague thing. It doesn't give you this great, oh wow.
Right.
So you can look up all this stuff is online.
Yeah. But that's like the mildest.
That's the mildest
of the punishments that you can get. That's public.
Right.
record.
So the next thing is a probation.
Okay.
And you can either do a reporting probation or a non-reporting probation. A non-reporting probation is, you better not get another complaint filed against you in, let's just say, an arbitrary period of time, 6 months, a year, 2 years.
Okay. So the board will decide how long of a probation it is usually.
No, sometimes we would usually somebody who had already had a reprimand.
Okay.
Because they're not going to just keep reprimanding you. So if you've already had a reprimand, they're going to go up the scale of discipline at that point.
Okay.
So the odds of you just getting another reprimand, it could happen. And once again, I could also assess fines.
Right, or make you do more CE. Do
more CE. Right.
Okay.
Or it goes up the chain. So if you've already had a reprimand, so unless it's something so egregious that you need to be on probation like immediately. I mean, sometimes we skipped the reprimand and went right to probation, and sometimes we skipped that and went right for suspension because you're really doing bad things.
Okay.
It doesn't happen often.
Right.
And usually those cases are making the news.
Right.
Like the one in Western Illinois.
Right.
I think it even made the Chicagoland news.
But
and there was one in South Side of Chicago that made the news.
Okay. So it's reprimand, then suspension.
No. Reprimand, then probation.
Then probation, sorry. Then suspension.
And then suspension.
And then revocation.
Usually they don't revoke. Usually they'll just use an indefinite suspension.
I see.
Because they don't, an indefinite suspension, it's a legal thing. Rarely do we ever, as I said, you really ever had to take those actions. And for people like, oh my God, my license is going to be revoked. It's hard to take the license away from a veterinarian. Mm-hmm. They don't want to leave you with no ability to make a living.
Right.
So, there are some protections.
You have had to have done something very egregious.
And
probably
multiple times, and you are abusing. Yeah.
Yeah.
Yeah, that's exactly the people. Or you have a drug issue.
Uh-huh.
Or you have a mental illness issue that is so
interfering with
your ability to practice. And it's we had one person who was so mentally ill, the fire department, somebody allegedly broke into her clinic and they found some dead animal in the lobby. And she kind of came up with this bizarre story. And the complaint was actually submitted by the fire department when the fire alarm went off, that this veterinarian was just talking gibberish.
Wow.
And coming up with crazy things.
Mm-hmm.
And I wasn't, at that point, I was still new on the board. I was peripherally involved in that case.
Mm-hmm.
And yeah, she had these crazy theories on things. So, I mean, that's an example where,
right,
or you're convicted. You get arrested for drugs, DUI, child abuse, sexual abuse. I mean, we had some people who were sex offenders.
Oh my goodness!
Your license will get disciplined. Your license will get disciplined if you get a discipline in another state.
That's right.
So we've stopped
the
ability of somebody to be a bad apple in Florida. And this is what happened on the human side for a long time. You had a bad doctor, and they would just move states.
Right.
And set up shop.
Yes.
Until the body count went up.
Yes.
And finally, the departments, the state boards, there is an association of veterinary state boards. They talk to one another.
Mm-hmm.
So if you get a reprimand in Arizona,
mm-hmm.
it's going to show up in Illinois.
If it's considered something notable in Illinois. I just want to point out, do you remember when I first moved to Arizona, we arrived after a 4-day drive, and Alex and I went out to get some groceries, toilet paper, we left
mm-hmm.
the dogs in the house. We didn't realize that the back door was broken.
Right.
The dogs got out. And one of the dogs
allegedly
bit a jogger. Did not break the skin. Anyway, that's when I found out that dogs at large is a criminal offense in Arizona. And
so let's use that. So let's say they would have pursued that. You would have gotten of the conviction. It would have affected your Arizona license. And let's say for some reason you wanted to move back to Illinois,
mm-hmm.
but now you have a reprimand on your license.
Mm-hmm. Mm-hmm.
So if you told me that story,
mm-hmm.
well, I just got down there 4 days,
mm-hmm.
4-day drive, back door broken, didn't know that, just moved to a brand new house
mm-hmm.
that had sat empty for however long it sat empty.
Mm-hmm.
As a board member, I would say somebody was really gunning for you down in Arizona.
Yeah.
And I could sit there and say, I don't really care about that. It's not a practice-related violation.
Well, here's the thing. I actually did send a letter to the Illinois State Veterinary Medical Board saying, FYI, I'm facing, criminal misdemeanor charges in Arizona for dogs at large. I realize this is not a criminal charge in Illinois, but I know that I'm obliged to tell you about it. Do you need any information? I never heard anything.
No.
So, yeah.
But but let's say they would have reprimanded your license,
mm-hmm.
then it would just show up.
And then I would need to explain myself.
Yeah.
Gotcha.
But you got to remember, there's a lot of discretion
mm-hmm.
on most boards
mm-hmm.
because those things do happen.
Yeah. I remember reading this book, and I can't remember. I apologize. Maybe I'll remember some other time, and I'll put it in the show notes. But I read this book. It was written by an MD,
mm-hmm.
and one of the lines that I remember out of that book is when she says, "Sometimes I long for an irresponsible life." Because once you become a doctor, whatever you do, it doesn't have to be anything to do with practicing medicine. If you get a DUI, if you, get in an altercation with some jerk at a bar and fists fly and then you get, thrown in prison, all of these things, anything can affect your medical license.
Yeah, it can.
Yeah. So all the fun is over.
No, you just are a little bit more careful in your fun.
You have to be 100% responsible all the time.
Yeah.
You really do, Whereas, I don't know if you had a desk job, like my old job in advertising. Would they care? No. So I could go out and get a little crazy and not worry so much. So just so you know out there, it's the end of your irresponsible lives once you become a medical professional, a doctor.
So most of the things that seem to cause complaints to happen really were communication, lack of communication, and I'm going to use the E word, lack of expectation management.
Okay.
You didn't inform that person, hey, some bad things could happen. Your pet could die. And maybe you didn't use it in those direct words because we don't like to use the D word. It's like dropping the C-bomb in a discussion.
Right.
But you're obligated to kind of say, hey, this is something that your pet, this could result in death. Mm-hmm. So sometimes not controlling somebody's expectations. And sometimes, there's crazy people out there. A lot of the cases, I would say 85% were either grieving, they didn't want to pay the bill, they had no concept of what was happening, they just could not understand anything with their pet's care. Mm-hmm. So of course, when something bad would happen, must have been somebody's fault. Mm-hmm. Mm-hmm. Or a lot of them just had unrealistic expectations.
Mm-hmm. Right. So it's important to say so this is what we've agreed that we're going to do, but I need you to understand this could go wrong, that could go wrong. And because part of the problem with setting expectations is you're talking to somebody who doesn't understand most likely much.
And a lot of these were medical or monetary.
Okay.
And how many times do people say, well, I'll spend the money if I know it's going to be okay.
Right. And you have to say,
and sometimes
money doesn't guarantee anything.
We can be talking about significant sums of money. Mm-hmm. Mm-hmm. And all of a sudden, you have a deceased pet and a $5,000 bill.
Right. I mean, even an elective orthopedic procedure, like a hip replacement, you could end up, like having a bone marrow embolus, a huge pulmonary emboli, and the dog dies.
I don't know that you can necessarily go through every single, but the big ones.
No, but you need to let them know.
You may get an infection. You may need a second surgery.
Right. Every procedure, everything has a risk. Yes.
And so it's expectation management and appropriate risk analysis.
Yes.
Which you, the practitioner, are capable of doing.
Right. And communication, making sure that they understand what you're saying. And I think sometimes I remember when I first started, and I would do a lot of talking, and I don't know if anybody understood a word I said.
It's not easy.
Yeah, so that's something that comes with practice, but if you know ahead of time that it's something you should work on, maybe you get better at it faster than I got good at it. But it's really important to not just talk, but to ask questions to verify that the person you're talking to has understood what you said.
Yes.
Yeah.
As best as you're able to do.
Okay. Well, I think we've covered the process pretty much. Everything, I think that most states basically follow the same process that you described. When I read through the statutes and administrative rules in Arizona, it was very similar.
There's a lot of things that are vague, and they're vague for a reason, because the standard is moving. You need to have a lot of flexibility and discretion.
Yeah.
Because rarely are two situations ever textbook the same. They're not. There's always some different variable in this case versus that case.
Yeah, that's how medicine is. I don't think there's any medical cases.
And I think you have to take that into account.
Yeah,
you can't not take that into account.
Yeah. So this is one of the jobs that will never be replaced by robots.
Well, as long as it's not replaced by attorneys, because I think their standard would be a lot higher and harder to live by. Mm-hmm. Because once again, their expectations that everything should.
But that just wouldn't be appropriate, because you have to understand medicine in order to understand that you can do everything right
and still have things not go the way you want it to.
Exactly.
Absolutely.
And that happens all the time.
Yes,
you do everything right and things still go wrong.
Remember,
because we're not cars like dogs and people and cats.
They don't
we're
read
not
the book.
Cars. Yeah. And this isn't engineering. It isn't perfect. You could treat somebody with a medication, and cure them, but treat another person with the same disease with that same medication, and because of minor and genetic variances,
you get a
totally different outcome,
or an adverse drug,
that you could not have predicted.
Correct.
I mean, that's just the nature of medicine, just like minor genetic variations. And you don't know about that. You can't point at somebody and say, oh, that was because of a minor genetic variance. That didn't work out, So, yeah, I think you have to have medical doctors making these decisions. I really do.
Well, yeah.
And is there, you make it sound like there's a risk that this might not always be the case.
Oh, I would hope it, I would hope it wouldn't be. But certainly attorneys are looking at veterinarians as a new group of people to sue. I mean, in law schools, they're holding classes on veterinary liability.
Oh my.
I mean, that's becoming, especially I think with more corporations out there employing veterinarians, corporations have deeper pockets. Now you have somebody to go after.
Oh my goodness.
I mean, it hasn't happened yet.
But they're gearing up for that.
Well, and I think also, the fact that the status of pets, legally it's property, but is it really?
Right.
It's still a sentient being. It's not a child. It's not a human.
Right.
But it's not your toaster either.
Exactly.
So,
and that's in flux.
That's in flux.
I think, hasn't it, didn't they change that in 1 or 2 states in the U.S.?
I think probably California. Usually things happen on the coast and spread inwards.
Right. Before vet school, I was all for that because I hated the idea of, calling pets property. But now that I'm a veterinarian and I understand, I don't think they're property. But if you start saying that they're, what they want to say, I do believe they're sentient creatures. But if you start giving them that legal status, then I don't know how the veterinary profession is going to be able to survive financially.
It would be a challenge.
Because we cannot, based on, people don't want to pay for gold standard care as it is. A lot of people can't afford it
or won't.
Or won't afford it. And if you start saying that, the dog is the same as a child, then we have to do gold standard. And if a dog is the same as a child, then I need to have insurance that covers a lot more. It's not going to be $300 a year, I tell you what. And how am I going to be able to pay for that if I can't charge appropriate prices?
I don't know if it's just being worried about nothing.
Yeah. Well, that's why, the AVMA is an organization that's supposed to be.
Some of the state boards were talking about those things. Yeah. And every practice act sunsets after usually a decade.
Okay.
It closes and you renew it.
Okay.
It's a legislative thing.
Okay.
So at the end of that decade, you reopen the Practice Act, and that's your time to make changes to it, to reflect veterinary medicine is changing.
Okay.
So, unfortunately, this is where other groups then can try to make changes to your Practice Act, and with specifically physical therapists. We want to be able to provide veterinary services to pets by ourselves.
Without veterinary supervision.
Correct.
Right.
So they wanted to get in there and that's a huge thing.
Right. Yeah.
Or I can just open up my sign,
chiropractors.
April's chiropractic clinic. Yeah. I've taken a few courses.
Right. Online.
Your pet is lame. Come on in. Well, I'm not going to fix your pet if it's got a cruciate ligament, or it's got Lyme disease, or it's got some other issue.
And yes, and that's why the Practice Act exists, so that people can't just go out there and say, I can treat your pet.
Right.
And so that, the medical board, the veterinary medical board will go to those people and shut them down.
Issue a cease and desist.
Yeah.
It's very hard because at the end of the day,
it happens all the time, and I think it takes somebody complaining about them.
And we did get a lot of those complaints. That was another set of complaints on non-anesthetic dentistry scaling from the groomer.
Oh dear, yeah.
Just as good as a dental.
Can you explain what that is?
Well, that's when they would just scale your pet's teeth while they're
wide awake.
Wide awake.
Yeah. So for those people listening, this is a no-no.
Well, you can't get, and I haven't done dentistry in the ER for a really long time unless unless there's a medical reason. So I don't do dental. I think they call them cohats now or something, or they keep changing the name. Prophies, or they don't call
prophylactics,
them. Right. Yeah, they don't call them dentals anymore.
But you have to get under the gum line.
You have to get under that subgingival area, dental x-rays. obviously, because sometimes you can have bad roots, you can have retained roots, you can have carried lesions. I mean, there's so much more than just scraping a few teeth and saying, well, that's good.
Right, exactly. I mean, imagine going to your dentist and just scraping off. I'll just scrape off the parts that you can see. How about that?
But your average person says, gee, why do I have to pay $400? Versus my groomer can do this for like an extra $40.
Right. Yeah.
They have no point of reference to compare the two. You're comparing apples to oranges.
Yeah. So
those were some of the complaints we got on the board. Cease and desist, people wanting to treat animals, especially with more shelters kind of coming in now and starting to have, adopt animals out. We had, sometimes shelters that would just dispense antibiotics.
Oh, my.
They come back here and, without a vet overseeing it necessarily.
Oh, my. Okay. Yeah.
There's all kinds of things.
So that's the Practice Act. But when it comes to, whether or not the decision is going to be made to grant, sentient creature status to a dog, that's not the Practice Act.
No. That's the legislature.
Right.
That's legislated.
Right. So that we don't have as much control over that. No. I mean, I think that the AVMA and other veterinary organizations
are generally opposed to that.
They're definitely opposed to it, but they're actually try to be actively involved in those conversations. Yes. So because people who don't know what it's like to be a veterinarian would not understand, why wouldn't you want this to happen? Don't you love animals?
Because costs would get out of control.
I understand that now as a vet, but before vet school, I was all for it. And now I know that would have the potential to make it absolutely
the other thing
impossible to be a vet.
If a parent doesn't seek medical attention for their child can be taken away.
Yes.
And they can face criminal charges.
Yes.
Is that going to happen on the veterinary side?
Yeah. Well, it does happen on the
veterinary. It does. I mean, you can call animal control if somebody, it's usually there's an online blowback from that. So, sometimes it's difficult.
What do you mean an online blowback?
Oh, let's say you allege that somebody's doing something negligent to their pet. Usually those people, those group of people, believe it or not, scream the loudest about how they're not and you're evil and you don't understand.
Oh, that's if the vet reports somebody for negligence, But I don't know. It is really interesting though, because not that it doesn't have to be a vet that calls and says, "Hey, I think this person is neglecting or abusing their animal." But animal control will investigate. If they think it's true, they'll take the pet away, and potentially there can be,
But going back to, how do you avoid a board complaint? Because that we've gotten off topic.
Yes, but it's all been very interesting. But yes.
Practice first and foremost, practice good medicine. Quality is job one. Practice good medicine. Stay current. Keep good medical records. Communicate effectively and set reasonable expectations on risks, potential complications. Not every single complication, because people would be so scared off, but but the big stuff. And another thing that I didn't bring up, refer when needed. Boy, if you find yourself in a hole,
that's what you're
stop digging. Offer referral. And even at 28 years out, we have specialists and internists. They're wonderful resources. I'm not saying it's not good to know how to do your own ultrasounds.
But you will never be as good as a radiologist who went to a residency and spent years learning how to do.
Because if you take on a procedure, you need to do it competently, not as competently as a boarded surgeon.
Right.
Because you're not held to that standard.
That may be coming though.
Boy, I hope not.
Yeah, I think it may. I don't know. It's very interesting because 20 years ago when it was the James Harriet character, right?
You did everything.
Mixed practice, and they did everything, and there were no specialists. And
at the vet school,
no specialists.
Those are your specialists,
right?
At the vet school.
Well, that might be 8 hours away. Whatever, and the veterinarian, it was either do it or the animal's going to die. Yep. And so they did it.
And people were willing to accept. Maybe, that you tried, if you're close to a referral center in any major metropolitan center, there's going to be a referral center. And they want to go,
You better, yeah.
Send them.
Yeah.
Another thing is keeping cases in hospital after hours unattended. That was another one that garnered a lot of complaints, especially animals in respiratory distress.
Yeah.
If you,
I think there's a law. I don't know if it's every state, but now you have to. Some states say have to tell owners
people
there's nobody here
after hours.
I can't imagine not telling. I mean, I can't imagine keeping an animal overnight and not telling them.
I remember when I was a technician, I worked at a hospital. And this is over 30 years ago. So you would do a bloat surgery. You did a tube gastropexy because things like incisional gastropexies hadn't been invented yet. So you did a tube gastropexy. You put the animal,
which is like a stomach tube.
Yeah,
right?
yeah. So you put the animal in the run. You gave him some fluid. Your fluid therapy probably wasn't as good. And I remember coming in and the animal was dead the next day.
Oh my God. But that was 30 years ago.
That was 30 years ago.
And we know more than we did.
And we know more than, exactly. We know so much more about the critical care, stabilizing these animals, different procedures.
Yes.
But if you're doing something like that today, you don't need to be keeping that case in hospital. Who's going to give it pain meds, fluids? Who's going to make sure that the animal is stable overnight?
Right. Crazy.
So when people don't refer to their local ER clinic, they get themselves in a world of hurt.
Yeah.
When something goes wrong.
Right.
You come in and that animal is disconnected and it's IV fluids and it's bled everywhere. And now it's anemic. And you're explaining to the owner, we need to transfuse your pet. Well, why?
Right.
Those tend to, and it's hard. It's hard to defend that.
Absolutely.
Those are the ones that you're going to get a reprimand.
Yeah.
You can't defend it.
No, you can't.
It's indefensible.
Right.
So, big things like that are easy, but you'd be surprised how many people still either send them home, like somebody did an enterotomy. They sent the dog home the same day.
A surgery
to remove a foreign object. He sent the dog home that night. Didn't tell them what to watch for. Subsequently, the dog broke down, developed a peritonitis.
Oh, no.
So, I've heard these stories.
Right.
Or the one who the dog came in, it was in respiratory distress. Well, I'll put it in the cage, and I'll take another x-ray in the morning. Except the dog was dead in the morning. Complaint on that.
Yeah.
There's certain things that are just that indefensible.
Right.
Most things fall in a gray zone. They really do.
Yeah.
And you hope you get a board member. And this is the other thing that's really variable. Some board members are much more by the book. And some are, I've been in practice. I know that things can happen. I know things don't,
It's not a perfect world.
It's not a perfect world, and I'll take that into account. Now, if you come in with an arrogant, egotistical attitude, so
attitude, very important.
I'm not saying you have to come in with your hand in your hand saying, "Oh my God, please don't flog me."
Yeah.
But coming in like, like I did nothing wrong. Well, wait a minute, you're not the judge of that,
right?
And that's not going to score you points.
Yeah. So
because
it's an attitude
when you're that arrogant, that sounds that you're pretty convinced you can't do any wrong.
Right. So you can come in with the attitude like, I've looked over this medical record, I've done my best to remember everything, and I'm pretty sure I didn't do anything wrong.
But if somebody did do something, let's say minorly wrong.
No, I'm just saying that attitude,
right.
But
yeah, I don't think I did anything wrong.
But not the arrogant. I don't think I did anything wrong.
Right.
But I don't think I did. But I'm here, and if you find that I did.
One of the things that we would do in our informal conference is if you can take yourself out of, let's say you're no longer the respondent, and you're looking at this medical record from my point, what would you have done differently?
Okay.
Oh, I would have done this, and this differently.
Okay.
That's all I really wanted to hear. Okay. Maybe you acknowledged, oh yeah, I shouldn't have done that.
If it's something valid, yes. Yeah.
Or did you consider this?
Okay, so coming in and saying, I should have done.
Or I considered this. I just wanted to know, what was your train of thought? What was your thinking? The whole point of a medical record is if you write it, I should be able to pick it up, know what you were thinking, what your concerns were, where you left off with therapy, and pick up and be able to keep going. That's what a medical record is supposed to do for you.
That's exactly right. the purpose of a medical record is that some other doctor
can pick it up.
You go out and you get hit by a bus,
yep.
and some other doctor has to take over all your cases.
All your cases.
Where were you? Why were you there? What were you doing and why? And what were the client's ideas? And yeah.
And what discussion? Yeah. So, I mean, so those are the things you can largely do to avoid a board complaint, and just knowing that, you know what, it's a numbers game. If at some point in time, if it happens, it's not the end of the world. I used to walk around like fearful. Oh my gosh, I'm never, you know, if it happens, it happens.
Mm-hmm.
Hopefully it won't be because I did something egregious or I, you know, did something really bad.
Yeah. I remember just last night we were talking over dinner, and you said that since being on the Veterinary Medical Board in Illinois,
it changed.
You
it
became
absolutely changed.
less scared.
I became less scared because I saw the process. I also saw what other people did that got them into that situation. It's like, it's like reading the anatomy of a train wreck or a plane wreck. Oh, that's where he should have done this.
Right. A lot of times it's just obvious. Like,
yeah. But when you're in it and you're distracted, you've got other things to do, you've got tunnel vision, and you're just running through appointments. Now, does that mean that, once again, you're going to get reprimanded? Not necessarily. Yeah. If you can acknowledge, boy, yeah, maybe I would, in my next case, this is what I'm going to do so this doesn't happen again.
Yes.
That's really, I'm looking for awareness.
Yes.
To nudge you, practice, I hate to, we talk about defensive driving. You can practice defensively. Doesn't mean you have to practice scared.
Mm-hmm.
Just means you practice, and once again, how do you practice defensively? The biggest thing is practicing good quality medicine.
Good quality medicine. Or at least offering it.
At least offering it and documenting when they say, no, I don't want to do that.
And letting them know what the consequences may be.
Correct.
If they don't do the gold standard, right? Yeah. Okay.
But, once again, and coming up with, VC options, and here's...
Right. Yes.
And expectation management. We'll go back to that dreaded E word.
That is huge. And so I would say, the funny thing is, so in Arizona, I had to sit for a state board exam, but not every state in the United States requires a state exam.
No, a lot of them don't.
And, when I moved out here, I was like, the pain, I don't want to do this. I didn't have to do it for Illinois. And my husband doesn't have to.
No.
Like, MDs do not have to sit for state boards. But I will say this in defense of having a state board exam. Most of it there was some of it about, diseases that are more common in this part of the country, right? Like valley fever.
Yep.
But most of it was about the statutes and the administrative rules.
The rules and regs, yeah.
Yes. And I will say that in Illinois, one of the things that made me more nervous is that I didn't know what they were.
But
because nobody said, hey, you should read these, because there was no exam for me to take, And I don't think I ever got an email saying, here they are, you should read them.
They are all published. They are all online.
They're available.
Find them, yeah.
They're available. But I didn't even have the thought to, go and I think I skimmed over them. But
and half of it talks about medical stuff, but a lot of it talks about ethical behavior.
Mm-hmm. Yeah.
Fee splitting, referring to you, but I get a kickback. I mean, there are certain things that you can't do that.
Right. And what technicians are allowed to do.
Holding yourself out is something that you're not.
Right. Yeah. Yeah. So it's really important to actually read the statutes and the administrative rules for the state where you're practicing, even if you're not required to take an exam on those.
Yeah.
Yeah. Because it varies by state.
It does. A lot sometimes, yeah.
And but the thing with the Illinois ones, when I did finally read them, I don't recall them ever explaining the process like you've explained it. Whereas in Arizona, the process was very clearly explained.
Yeah, I mean, I think there is a section on that. It's I've been off the board now for a couple of years, and Illinois being under such a budget crunch, they stopped printing out little booklets. So the last one I have is 2011. And I won't give it up. And I used to have tabs on everything so I could refer to it.
Wow. Okay.
Because, when somebody brings a complaint,
right,
which part of that practice act are you alleging that they violated?
Yes.
Does it fall under anything?
Right. Yeah, and so that's the other thing. Like the Illinois Veterinary Medical Board, like we were talking about, that the Department of Professional Regulation,
Financial professional regulation.
They're spread very thin.
Yep.
And their website, I did not find it very helpful. And I think that the statutes were like spread out all over. And if you didn't search for the right thing on the site, you wouldn't get everything. So the other piece of advice I might give my former self that was like looking for these things and not able to find everything I should have is go to the state. Or no, I can't. What would you do in a situation like Illinois? Like, I couldn't even. I tried to call, nobody would call me back. I sent an email.
They almost want you to do stuff online now.
But how would you even find everything that you needed to? I couldn't.
You have to just. Yeah,
maybe ask other vets. Maybe
no, just get on their website, and usually you can find it, but you got to look. It may not be as. It depends on what you're looking for.
But that's the problem. Like, I didn't even know what I was looking for. I wanted to find everything that was related to the practice of veterinary medicine.
If you just type into your browser Illinois Veterinary Practice Act, it'll come up.
Okay.
Yeah,
but it's in terms of like the administrative rules, which is where they explain the process.
It's in there.
It's in the Practice Act. Okay.
It is.
Okay. All right. Search for the state Practice Act if you can't get it.
And that's what I did when I was. One of the things I did while I was on the board is I helped draft a new rule that allowed the dispensing of medications under very select, specific instances without necessarily having to have a VCPR.
Can you explain what the VCPR is?
The veterinary client-patient relationship, which is what you have to practice.
Yes.
Which means you've seen the patient, you're familiar with the patient, you're keeping medical records, you're the decision maker, you've instituted treatments, and you're responsible for not the outcome, but the care of that patient until the owner decides to sever that relationship, or you refer it, or the patient dies, or they move away, or whatever, or something like that.
And it expires if you haven't seen that patient with a certain amount of time.
Yes, it does. It does. It's not ad infinitum.
Which is what people get pissed off because they call and their pet hasn't been seen for 2 years.
2 years, and they want
like a prescription for an whatever.
But what this rule in Reg basically said, and I looked at other practice acts to draft it. I think I pulled up like 20 different practice acts. So that's what I got online. And I would type in Texas Veterinary Practice Act, and I would print it out. I had stacks of paper. I went through a small tree, because trying to compare to because not everybody has it. Most people say you have to dispense drugs solely within the confines of VCPR. Now, being from an emergency clinician, and I was the only ER clinician on the board, most of them were, I think they had a mixed animal practitioner, and mostly they were small animal vets.
Okay.
I was strictly ER. And I said, look, there's times when somebody is traveling. They're visiting from out of state. Their pet is, let's say, on anticonvulsants. And anti-seizure medication. And oh my gosh, they look down. And once again, people never plan. They get down to the last 2 pills and they think maybe they'll have a family. They'll be more somehow open and, oh, look, it's refilled. And they say, oh my gosh, I don't want my pet to be off this because he could have a seizure. It's important. You just don't stop abruptly. Normally you would have to go in and have a physical exam. But you've already established that with your family veterinarian. So, assuming that the animal was okay, you could bring in, you could provide proof that, your pet's really on this, and I could not give you a full month's amount, but I could give you, let's say, 3 days to get you through the weekend, so you could call your family vet over in Arizona as you're visiting family in Illinois, saying, could you call this into the Walmart? Because, hey, maybe it's Christmas and you're closed. Or cardiac meds. Things like that, where you don't want them to be off of their vet med and their cardiac meds, because you don't want them to go back into heart failure and end up at the ER. And I don't need to re-diagnose it.
Exactly.
Your family veterinarian already did that. So it allows veterinarians to dispense a very finite number of days
for a specific kinds of drugs.
Exactly.
Under certain very specific circumstances.
So, diabetic. They need believe it or not, you don't need the prescription to get the insulin. You need the prescription to get the needles.
I know, that's so weird.
So if somebody comes in, they say, here's my insulin, which is why people who are traveling should have some idea, a summary of medical. What is your pet on? How often? I mean, that's a different talk altogether. Because you don't want your pet to be off insulin.
Right. Okay. Well, and that's just in Illinois, though.
That rule is not in every state, but I looked at other practice acts when I drafted the rule, I submitted, I said, here's why it's important. And the board and the ISVMA actually said, it's not a bad idea.
Yeah.
It's a very narrow instance.
Yeah.
It doesn't say give your cleaner out to a dog you haven't seen in 2 years.
Right. Absolutely. But the example you gave was perfect. Is somebody traveling through on their way to visit grandma for Christmas, and it was crazy. They got three screaming kids, and they forgot to
refill them. And they got there and went, oh no, and nobody's open now.
Right.
Everybody, you're the only person who's open.
Yeah. I think that's absolutely.
And you could sit there, and usually, and I said, look. When I was drafting the rule, I went through a lot to help with it. I said, well, how do you know that animal is in respiratory failure because most people are pretty, they have a dog in heart failure, they're already kind of tuned in to the clinical side. Most, and you can certainly ask them, and you still have to keep records, and they have to prove their pet has a medical need.
So they would bring in the prescription, all the information about their regular veterinarian. You would write a record.
It doesn't have to be a formal record. No, it just has to be, refilled, and you're limited to how many times you can do this. I said, look, the odds of people drug seeking. I mean, you're really going to drive to every emergency clinic in the northern Illinois area to get your 3 days worth of phenobarb? Really?
Right.
It's not worth your time.
Yeah. But then that record would be sent to the person's vet so that they
not necessarily.
Oh, no. Okay.
No, it's just you're just trying to get them enough to get them through so that they can.
Yeah. But this is another thing that, when I started practicing at the ER, I didn't know what the state law was on this subject, right. So I think that's an important thing to find out. Because we always get calls, so-and-so, is on this med.
Yes,
all the time.
So-and-so's on this med, they're from out of town.
Yes.
Or their vet is closed.
Yes.
For the long weekend. That's holiday.
What would happen most often. It was somebody in town.
I can't get a hold of my vet.
They just, really? I refilled my prescriptions 2 weeks in advance, and you run out on a Saturday.
You're uber organized and highly motivated.
Well, I just don't understand it. But that happened a lot.
Life gets in the way.
Oh, yes. Well, anyway, but I think that's a really, really good thing to tell people is to know, are you allowed to do that or not?
Right. And it's up to your discretion. Nobody says you have to. It's written.
But are you allowed to?
You're allowed to, but you don't have to.
But that's in Illinois.
It's in Illinois.
In some states, you may not be allowed to do that.
You may not be allowed to do that at all.
At all. So you have to look at your
Texas
practice
had something
act.
similar.
Okay.
So, I think I found that. Actually, I think I pulled 30 practice acts. And some of them are very thin. I mean, like South Carolina's, I'm like, you got to be kidding. It sounds like 3 pages.
Wow.
And you get Illinois is like 20 or 30 pages. And you get New York's, which is in Florida and California. They're like, really,
Yeah. All right. Well, I think that covers your experiences on the board and the process that people would have to go through. And what I was hoping is that hearing your experience and hearing you explain the process and what it's really like would maybe reduce the anxiety for other people out there.
Yeah, I would hope
so. They don't have to be as scared as you were before being on the board, as I was before hearing your story.
Everyone hears horror stories, and I know people have gotten railroaded. If you're ever faced with a board complaint and you feel somebody wants to give you a report, you don't have to accept it. You can go to a formal hearing.
And that's when you really want to make sure that you've got licensed defense.
You want licensed defense. You want to be able to, you better be able to provide a witness, an expert witness to refute the state's case.
Okay. Expert ones, like another veterinarian or specialist.
And there are people who, and that's part of the problem is, sometimes finding that for somebody who is, not, because they're, they don't want to take out their time
for their day. Yeah. There are some people that are expert witnesses, and that's their job.
They're right, especially in the medical. I think especially in the medical field. Yeah,
exactly. Because you're a surgeon. What, you're going to take the day off to go?
Right.
No, that's like, how are you going to pay your bills and your student loans if you're doing that all the time? So yeah, you'd have to find somebody who does that regularly, and that they get paid for.
And I would say the overwhelming majority of complaints
never gets there
because that person bringing the complaint has that standard. They have to, they have to provide a witness. They have to provide an expert witness.
I see.
A lot of times.
Okay. Well, is there any other random piece of advice you'd like to offer future veterinary doctors while we're here before we wrap it up? I'm going to the career fair, so we're, there's a career, what is it? What do they call it?
Career fair?
Is it a career fair? From 3 to 6 today in Reno for this conference. And I don't know what it's like. I've never been to one before, but I wanted to go just to see what it was like. And I brought my resume and everything. So that's where we're going to head after this, but after we wrap this up. But
no, just I think the 5 points: practice good medicine, stay current, communicate effectively, project empathy. I know they talk about that. Manage expectations, keep great medical records. And just the other thing you can do, get the license defense.
License defense, for sure. Yeah. Okay. Well, Dr. Alicia Ragni, thank you so much for being here. And I'm so sorry that we had to do this interview while you're hoarse. But thank you. I really appreciate it. And
just a little horse.
Just a little horse. I still think it's like Betty Davis, and it's very sexy. But I think that a lot of people are going to hear this, and it's going to help clarify a lot and maybe bring some anxiety down for them in the future. And so on behalf of them, I thank you.
Thank you.